Pfizer is making a push to get its COVID-19 vaccine into the arms of children ages 6 months to 5 years old. Yahoo Finance senior healthcare reporter Anjalee Khemlani has the details. Anjalee.
That's right, Brian. And we know that last week or a week before, we knew that the data came in from Pfizer, but now they actually have the fully filing submitted to the FDA. And now we're going to wait until mid-June, of course, that June 15th date, where Pfizer and Moderna are going to get a chance to get in front of that FDA advisory committee and get their data heard and just, hash out the details and see really if both or just one make it through. We know that the difference, as you can see on your screen, the data from Pfizer, they said they had an 80% efficacy for symptomatic cases, and that is based on 3 doses of their vaccine. Meanwhile, Moderna only looking at 2 doses and sticking to, despite lower efficacy numbers that we saw in those 2 separate cohorts that make up that under 5, under 6 category. So really a lot to look at right now, and that committee is really going to have a lot to wade through when it comes to this data for those younger kids. But of course, we know that is the last remaining population, of course, that doesn't have a vaccine. So definitely have to wait and see what those details end up being.
Okay, so we know that these authorizations have moved forward either for a request for the approval or just by getting more data. But at this point in time, moving forward, when we think about when government subsidies stop for the purchases, what happens for people after that?
Well, that has been the question, right? We know that, of course, that is on the table when it comes to Congress and a lot going on when it comes to what happens after. Will insurers continue to take that on? Will people be on the hook for that? And we know that's probably not going to be as popular. So obviously still a wait and see situation there.